President, sorry, am I muted?
You're unmuted now. Hi, Tim.
Good.
How are you? I know Minnesota's great, but it can't be as nice a weather as there is in Mexico now, is there? So, anyway, you all are nice to take the time.
Always summer.
Yeah. Well, I'm just waiting for them to tell me when we get going here, since we're live streaming this.
You're good.
Oh, ready to go? Okay. Well, first of all, hi, everybody. It's good. I'm supposed to look over here, not at you guys. But we got 6 governors with us today, Democrats and Republicans. And they're meeting the moment. Governor Mills of Maine, Governor DeWine of Ohio, Governor Cox of Utah, Governor Walz of Minnesota, Governor Baker of Massachusetts, and Governor Lujan Grisham of New Mexico. And it's great to connect with you all. You know, last week I provided an update on where we were with our vaccination program and what comes next. And I said our goal by July the 4th is to have 70% of adult Americans with at least one shot and 160 million Americans fully vaccinated. And that's a pretty huge goal, I acknowledge that, but you've done a remarkable job. But if we succeed, we're going to be able to take a serious step toward the return to normalcy by Independence Day, which is a goal that was not arbitrarily, but based on talking to the docs, thought if we did what we had to do, we could meet. And there's a lot of work to do, though, to get there, but I believe we can get there. And part of the reason I'm so confident is because of your leadership, the governors, and your partnership with us. The governors with us today and their counterparts have been instrumental in helping us make progress and more quickly than anyone would have thought. Working together, we delivered over 220 million shots in my first 100 days, well beyond anyone's expectations, but because of their cooperation. And today, more than 150 million Americans have gotten at least one shot. Over 115 million Americans are fully vaccinated. Nearly 85% of people, 65 and over have gotten at least one shot. And whether it's a red state or a blue state, black, white, Latino, AAPI, Americans from every walk of life are getting their vaccines. We got more to do, though. Now cases and hospitalizations and deaths are all down. Tens of thousands of moms and dads, brothers and sisters, grandparents, neighbors, friends are still with us who I believe whom would have otherwise we would have lost, but for the work of these governors. And millions of Americans are starting to live life more normally after more than a year of sacrifice. And I know everybody's tired of hearing me say this online here, but it isn't Democratic progress or Republican progress, it's American progress. And now we've got to take the next step together. I know every week you meet with Jeff Zients, who's here with me, and you go through it, and I've had a chance to meet with the Governor's Conference and others, but we decided from the very beginning, as you all remember, that how many govs did you speak with in the last, just today?
Well, today we had our weekly call, so I hope most governors attend that call, which is great.
And but the point is that we know we want to get something done. It's all about governors and mayors and county executives, all local. It's on the street. And to meet the goal that I set last week, we need to accomplish 3 things in my view. One, we have to make it easier and more convenient for all Americans to get vaccinated, and you're busting your neck doing that. 2, to build confidence in vaccines by delivering facts and answer questions to anyone who might have one and have thorough answers. And 3, by ensuring that we reach everyone with an equitable response that as we enter this next phase. And to help us get there, we've added 2 new tools. One, Americans can go to vaccines.gov, or they can text their zip code to their zip code, text it to 438829. Let me say it again, 438829. And they'll get at least 3 locations near them with vaccines in stock at that moment. And at my direction, more than 20,000 pharmacies coast to coast are now offering walk-in vaccinations by no appointment necessary. And the governors, you all are stepping up to increase the availability of walk-in vaccinations as well. The Federal Emergency Management Agency, FEMA, is shifting focus from larger vaccination sites to smaller community-based sites and mobile clinics to reach more people where they are. And we've recently made significant new investments around vaccine education, including funds to help states and community organizations get the word out on the local level. Just yesterday, the Food and Drug Administration expanded the emergency use authorization for the Pfizer vaccine for children 12 to 15 years of age, 12 to 15. That means parents who want to protect their children, younger teens who want to get vaccinated. We're a step closer to that goal now. And today I'm also announcing additional steps to ensure that transportation is less of a barrier. From May 24th through July 4th, Uber and Lyft are both going to offer everyone free rides to and from vaccination sites. I think that is really stepping up. Both Uber and Lyft, free rides to, they'll wait, and from, they'll take you back home. And it makes it easy for students who will work with federal pharmacy partners to bring on campus vaccine sites to dozens of the nation's largest community colleges this summer. And I want to thank the governors here for making it easy as possible for students to get vaccinated. And finally, I'm announcing today that FEMA is making support available immediately for community vaccination outreach efforts. This will help states, tribes, territories, local governments, and community and faith-based organizations to make more progress on the ground. Things like phone banking, door-to-door canvassing, pop-up vaccination sites in workplaces and houses of worship. And so, once again, the governors in so many states, particularly the 6 that are here, have been essential partners in this effort. And they know it isn't about politics, it's about saving lives and livelihoods, rebuilding our economy and getting us back to our way of life. So it gets to have, the idea that we have 6 of the best governors who have worked on this with me today is really a pleasure. And all of you have done a remarkable job. And with your permission, I'd like to hear from you about the best practices and innovations that have worked for you, what you've learned across these 3 areas in improving access, building confidence, and ensuring equity. And I'd like to start by talking about improving access to vaccines. Governor Mills of Maine and Governor DeWine of Ohio, both of you have developed creative programs to meet people where they are. Governor Mills, if you don't mind, I'd like to ask you, how are you reaching out to people and encouraging them to get vaccinated, and what kind of success you have?
Thank you, Mr. President, and thank you for all you're doing to help us get shots in arms. It's a great honor to join you and fellow governors across the nation to share these innovative ways that Maine is vaccinating people against COVID-19. Maine has had some of the lowest numbers of COVID-19 cases, hospitalizations, and deaths in the country since the onset of the pandemic. But the people of our state believe in the science, and they have followed public health protocols to prevent the spread of the virus. Now we are closing in on the 70% of adults that you want us to close in on. 70% of adults in Maine having received at least 1 dose of COVID-19 vaccine. The goal you set. Right now we're at 67%.
All right.
And about 53% of all eligible people in Maine are fully vaccinated. Well, that achievement has not been without challenges. We're a rural state, as you know, of 1.3 million people, the most dispersed population of any state in the lower 48, with small cities, with towns surrounded by blueberry barrens, potato fields, and forests, towns on islands, people living at the very end of a road. In fact, when we asked people in Maine to stay 6 feet apart, or as the fishermen say, 1 fathom, some people asked, why so close? We're also the oldest state in the nation, with more than 20% of our population being over 65. So low population density and age are our big challenges. When we began this massive logistical undertaking, getting vaccines into arms, we focused on equity. We focused on addressing what made us the most most vulnerable to the virus. So we knew that older individuals were more likely to get very sick and suffer and die. So after healthcare providers and first responders, we then began vaccinating people over the age of 60. As the supply increased, thank you very much, and as we expanded eligibility by age. By April 7th, everyone 16 and older was eligible. Today, as I mentioned, more than half of all eligible people are fully vaccinated. Nearly every day, our state has led the nation in getting shots in arms. But we're not dropping our guard, we're not slowing down. Every shot in arm we know is a death prevented, a life saved, a family kept whole. So Maine is doubling down on access, especially in hard to reach communities and for people who are hesitant. Like the woman in Western Maine who drove a truck 5 miles down from her mountaintop home to be the first in line at the pharmacy one morning. If you build it, we thought, they will come. With remarkable cooperation by our big healthcare systems, we started with the mass vaccination clinics, with the National Guard, local personnel, and volunteers. Now we are participating with FEMA on a mobile vaccination unit that's getting to those hard-to-reach people in underserved populations. We have drive-through clinics for adults with intellectual and developmental disabilities. We're hosting pop-up clinics for hard-to-reach groups at their workplaces. We've vaccinated homebound seniors in their homes. And we've expanded walk-in hours and morning and late evening hours for shift workers, like the woman working the night shift in a bakery in Lewiston. We've brought clinics to the islands for fishermen's families. We've operated clinics at houses of worship, from mosques to the Methodists. And like many other states, we've offered free transportation and a very smooth vaccination experience. But I'm pleased to announce to you that as of today, for those who get their first shot between now and Memorial Day, we're offering a voucher from our Fish and Wildlife Department and our Parks and Conservation folks, and from retailers like LL Bean, the Portland Sea Dogs, our minor league baseball team, Charlie knows so well, and the Oxford Plains Speedway, our biggest racetrack, to get free tickets to a ball game or a race event, a free fishing license or hunting license, or a gift card for outdoor gear. We're calling this Your Shot to Get Outdoors. Oh, it's corny, I know. But we know that people in Maine have found refuge and relief in Mother Nature throughout the pandemic. So these incentives will encourage that outdoor activity while getting more shots in arms as quickly as possible. So thank you, Mr. President, for your support for all the states. Maine is doing everything we can to put this pandemic behind us. We're giving it our best shot. Thank you.
Well, Gov, thank you. Thank you. I think that it's remarkable what you're doing. And, you know, excuse me, well, I'll get back. I want to hear from Mike first, then I want to ask you both a question, if I may. Mike, Gov, fire away, Ohio.
Mr. President, thank you for doing this. We appreciate you listening. I want to say hi to Jeff and tell him we appreciate his work and the fact that he listens, and we're on the phone again today. So that's very, very helpful to us. Mr. President, we've taken a community approach to this. Ohio is a state of communities. We started off right from the word go about 650 locations. We're now up to 1,900 locations where people can get the shot. And in addition to that, we have new pop-up places every day. We have the mobile clinics out as well. And that's worked exceedingly well. We started early on with pharmacies, and we think that has been very important, as well as our health departments, as well as our federally qualified clinics and our hospitals. We have a lot of nursing homes and a lot of assisted living in Ohio. I think over 1,700. Yeah, and of course, we had a lot of deaths there. And so the first thing that we did on day one, literally, was to start focusing on those nursing homes and assisted living. Once we made working with the federal government, 3 passes through these nursing homes, we knew that was not enough, though, because we knew that they would be taking in new people. They would have new residents every day. They would have new employees every day. So we have set up a vaccine maintenance program that's working with their pharmacy and it's making sure that every single week they've got new vaccine going into these 1,700 nursing homes. And I think that that makes a huge difference, again, taking it to people where they are. Our National Guard is going out, and has been going out for weeks, into senior housing, taking it right into the lobby, setting up shop, vaccinating people. All they have to do is come down from their rooms. And that has worked, we think, very, very well. We're really decentralized in Ohio, Mr. President. We have 113 local health departments. And it's the local health departments, it's the mayors, it's the counties. They're the ones where really the action is. So I'm on the phone every Monday morning for 45 minutes with every one of our health departments, and I learn a lot. They tell us what they need, what we can do to help them. We try to get them right away, whatever they need. But we also hear from them the innovation that they're doing. And the innovation, as you know, as you said at the beginning, comes locally. And so we'll take that innovation from one health department, what they're doing, and then make sure that other health departments are aware of that, and other providers around the state are aware of that. So it's very, very, very important. We have taken vaccine in August. We went out, in February, we went out and vaccinated every teacher in the state who wanted to be vaccinated. We actually took the vaccine to a place close to them. In some cases, it was directly into their school. That enabled us to open up virtually every single school on March 1st. But again, it was taking it to them. We've done the same thing with colleges before college was out for the summer. We've done it working with our labor unions. We've done it working with businesses. A lot of innovation going on in businesses. And what we found is the businesses that have us come in, have a health partner that does it. They work very closely with their employees, and they're able to get an uptake that, quite candidly, I don't think we would have gotten any other way but by taking that directly into that business. We are really at the ground game now. We've always been at the ground game, but I think you're seeing governors, continue to push out and go to where people are. We have some health departments that are literally out knocking on doors. We have mobile clinics going around, and we want to reach people, exactly where they are. Just a couple observations. There certainly has been a appetite for the Johnson & Johnson. We're seeing that there are people who really want Johnson & Johnson. They want that one shot and to be done. There also clearly was an appetite for walk-up clinics. And so, most of the clinics in Ohio, as you said, are open for walk-ups. And there's people who just want to go. They want to make up their mind that day and go out and be able to knock on the door. Finally, we're very, very excited about being able to vaccinate 12, 13, 14, and 15-year-olds. And we've got plans in schools. We also have plans in the summer with Boys Club, Girls Clubs, feeding programs, and other things, trying to take this to where people are. So thank you for doing this, Mr. President. Well,
thank you both for what you guys are doing. And one of the things that I wanted to ask Governor Mills is that the idea of engaging in and offering benefits like everything from fishing licenses on, my guess is free tickets and vouchers, my guess is that's probably going to work. I mean, do you have any?
I think so. We're offering a great spectrum of things, and I think it'll be an incentive to those who are still hesitant. People who would love to go to LL Bean or go online and buy a new hunting vest or whatnot, and people who want to go to the Sea Dogs, because as Charlie Baker knows, the season has opened up. Yep. I think it's a good incentive. I know other states are doing something different. Yeah. Some are offering shots of booze, but New Jersey.
Can I ask you, both of you, one last question? I'm sorry to take so long here, but I'm interested. Tell me about what the mobile vaccine unit is like. I mean, are you driving around in with docs in a pickup truck, or No, I mean deadly earnest for people. This is being Zoomed. That talk to me about, if you each tell me what you're doing.
I've been through our mobile unit, and it's very attractive, very clean. It's a big trailer kind of
Yeah.
thing, a vehicle, and it's staffed by people from the United States Health Service, Public Health Service, and some National Guard and some FEMA people. It's a great level of cooperation among those agencies and with the state of Maine and local governments. And I've seen people delighted being able to drive up, get out, walk through the trailer, sit back in their car for 15 minutes, be watched, remotely, and drive off feeling free and clear of COVID.
Mike, how about you?
Mr. President, all mobile clinics are not alike, at least in Ohio. Just
Yeah.
a couple examples. Ohio Northern University is going out into small communities, and they announce when they're going to be there. They're going to be here this afternoon in this community. So it allows people in smaller communities to have it in their community, and they know when it's coming. We're seeing it in cities. I was in Cincinnati this past few days ago, and what they're doing is they're using that as a base, but they're going out. The one I saw was actually in a library. But they use that mobile clinic as kind of the base to store and to bring the vaccine out. So it's going out, it's trying to be innovative, trying to figure out, how do we take it directly to people? The reality is, and my wife Fran and I have been to, I think, 37, 38 different vaccine clinics. And we always talk to the people who are getting vaccinated. And yet we talk to those who have maybe hesitated in the past. And what you find is that sometimes they've been waiting, and they've been really waiting for an opportunity, something that makes it easier to do. It's not that they're against getting vaccine, they just haven't got around to it yet. And so getting that person, getting them the vaccines, make it easy, make it convenient, I think is very important.
Well, thank you both. You're doing a heck of a job. I'd like to turn to Governor Cox now of Utah and Governor Walz of Minnesota. Another critical issue is increasing confidence among people who are hesitant to get the vaccine. Governor Cox, I know you're bringing community leaders in to build confidence. Tell me about your efforts and how it practically is functioning, what you're seeing from those efforts.
Well, thank you, Mr. President. It's great to be with you. We appreciate Jeff taking all of our complaints over the past few months. He's been remarkable in helping us resolve all of those and mostly.
And by the way, he doesn't own any pharmacies. I just want you guys to know.
We're very well aware, but thanks for allowing us to participate and highlight some of the good things that you're doing and that are working well. By the way, just an aside and a tip for our media partners, I occasionally see reporting that focuses on what percentage of the total population has been vaccinated. That's great for places like Maine with the oldest population in the country, for places like Utah with the youngest population in the country, and of course, a large significant portion of our state that is not eligible to be vaccinated. That's not exactly the right metric to be using, but we're very excited for the announcement to allow younger people to get vaccinated because Utah has more of them than anywhere else. Mr. President, we're really good at having kids here, so we're excited to have that opportunity. When you talk about hesitancy, though, I want to mention that it's most important to be very flexible and adaptable. What was working a month ago isn't necessarily going to work today. Yeah. Of course, we have a vision for where we want to go and where we are in this phase of the vaccination campaign. Data collection is absolutely critical, and this is something I want to mention that the Governor DeWine just touched on. But while some states go into the field to do some polling, we are in the field every day of every week, constantly getting new data to understand that population that is remaining that hasn't gotten the vaccine. And I think that's really important for everyone to understand. We often just talk about the vaccine hesitant population as one big group, but it's really much more than that. I like to say we've moved from what I call the vaccine ecstatic and the vaccine excited phase, and we're now in the vaccine busy or the vaccine curious phase. These aren't people that refuse to get it. They just haven't gotten around to it yet. And I think we have to approach all of these groups a little differently. But with that data, that's allowed us to really focus on 3 specific areas: the why, the who, and the where. To overcome this vaccine hesitancy, we designed a public information campaign that not only answers questions and resolves concerns, but it helps people understand that getting the vaccine is the way to get back to the things that we all love, that we all want to do. Weddings and family reunions, Utah Jazz games, the best team in the league right now, churches, hugging grandparents, quinceañeras, all of those things that we care about. We want people to understand that the vaccine is really the key to ending that. And that's one area where we could use some help from the White House and others, and that is modeling what a fully vaccinated person can do. I like to say that we have fully vaccinated people, we should start acting like it. And that's a big motivation to get the unvaccinated to want to get vaccinated. Next up, we focus on the who. And I think, Mr. President, this may be the most important of all. Through our research, it became clear that people trust their family doctors, their local community leaders and church leaders, their family, friends, and neighbors a lot more than they trust government on this issue. So we've been working directly with those different voices to empower them and give them a platform to encourage vaccinations, which leads to the third, and the other governors have talked about this, so I won't take as much time, but the where is so important for this next phase and the next group of people now that we have enough vaccine for everyone. And so these mobile pop-up clinics that we're talking about really matter. And when you partner with the right voices in a community. So for example, in our Latino community, we're working with churches and pastors who will bring these mobile pop-up clinics right to the church where people can go and get those vaccinations. We've opened a portal to any organization in our state, businesses, churches, nonprofits, summer camps. Anyone that wants a mobile vaccination clinic can request one. We go directly to them. They have a party. People can come and get vaccinated. And we're finding that those trusted voices are helping us with that next phase of people who are a little unsure or just didn't have enough time to get around to it. We're taking out all of the excuses to not get a vaccine. And that's where we are now, Mr. President. We're excited as we continue to reach towards that goal of getting 70% of our adults vaccinated.
Well, you're doing a heck of a job. And the idea you're talking about is what we nationally can do in terms of drawing a portrait of what it means if you're fully vaccinated, what you can do and what you can't do relative to the rest of the population. And we're just getting there now to the degree that I think you're going to see a more aggressive effort on our part to lay out that once vaccinated, it's not only you can hug your grandchildren, you can do a lot more. And whether or not you have to have, even at some point soon, mask inside versus outside. I mean, so and if anything, we've gone a little slower to make sure we're exactly right as terms of the percent of the population that has been vaccinated, the adult population. But I think, Jeff, we're going to be moving on that in the next little bit, aren't we?
Yeah, I think we expect more and more guidance from the CDC for vaccinated people.
And, you know, it's not everything, but I think you're right about it would increase the prospects of the desire to get vaccinated, you know, as well. And one of the things, Tim, what are you seeing up in your state right now?
Well, first of all, thank you, Mr. President, for making this opportunity available. I'll echo our thanks to Jeff Zients and his team. They pick up the phone no matter what the question is, and they get us answers. I'd like to give a special thank you to the other governors who are on here. They have been a source of information and inspiration, best practices as we share together. And I would certainly associate myself with Governor Cox's remarks when it comes to confidence and how to get it done. I do think making that connection of what it means to get vaccinated and get it done quickly. We saw here in Minnesota where, along with Michigan, we saw a spike here recently in this latest surge around the B117 variant. But because of the availability of the vaccine, the speed that it had gotten out, we were able to blunt that. And what that meant is hospitals did not become overwhelmed. We did not have to close back down doing many of the things we were doing. And the most important thing is far fewer people died from that. So this idea of getting it into arms and getting it out there has real world consequences. And I do agree. The confidence is based on the data. Governor Cox is exactly right. We believe in the data. We believe in transparency. And for the governors who are on here, this is kind of the bane of our existence of trying to get this data because it gets pounced on. You're not doing this, you're doing that. But I think being transparent, open, and use that data with the public shows them you measure what you care about. And that's how we focused, much like it sounds like Utah. And my guess is many others are doing it. But each state's a little different. And I think we had some built-in advantages. One is we had trusted third-party validators like the Mayo Clinic to be able to validate some of this data. But we also have a tradition here. We had the highest voter turnout in the last election. We also had the highest census return. I'm sure that's to the angst of New York, but we were able to do that. And the strategies that it takes to get people to vote, like Governor Cox said, some are very enthusiastic about it. Some maybe go if they have the opportunity. Same thing with the census. So what we understood is the folks who make those so successful are local trusted partners, as you've heard. And one of the great success stories is listening to those folks who know how to do it. Here in Minnesota, we have 11 sovereign tribal nations. They did this better than anybody else in the country. They focused on their elders, they focused on multi-generational households, and they focused on delivering where people were at. That same model, we're kind of one of the centers of pork and poultry production. Those facilities were some of the hardest hit. Many of them are communities of color and immigrant community. They're multi-generational households that can spread amongst a nexus of Iowa, South Dakota, Minnesota. And those communities had many reasons to be hesitant. They were hit hard, there were casualties, there was a lack of trust in those communities. So there's a story got told on PBS NewsHour. A young organizer named Jessica Velasco used some of those principles in her community where she was well known, knocked door to door, and we saw some of the highest rates of uptake on the first days, above 70%. In these facilities where we were doing multi-generational vaccinations. So again, it's not assuming these people are hesitant, they're ideologically opposed. It's trying to understand where they're at, what are the differences. Some are going to respond differently to different groups. And then just candid, these outreach, the buses, the pulling into parking lots. Tonight I see Governor Baker's there. I'll be at the St. Paul Saints opener, a Twins affiliate, and we're giving vaccinations to folks coming through the gate as they come there. They know that a vaccinated Saints fan is someone in the seats, and it's starting to connect all these with partners. And when I got my vaccine, I was glad I took my friend along, a predecessor of mine, former Republican Governor Tim Paulini, and we got vaccinated together.